Good afternoon. Welcome to Sunday afternoon, day 408 at the EMA office. Joined today with Chairman Mark Kern and Sam Bierman from the Health Department. Sam, appreciate you joining us today.
Oh, absolutely.
And you've got the numbers for us.
Yes. So as of today, 335,474 St. Clair County residents have been tested, which is an increase of 841 from yesterday. We have 30,279 positive test results, which is an increase of 36 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. And our daily county positivity rate today is 4.3%. We have 305,195 negative test results, and we are reporting no new additional deaths today, so we remain at 475. For those who have completed the IDPH required 10-day isolation period, we are at 29,412. For state totals, 22,269,555 have been tested, with 1,321,033 positive test results, which is an increase of 2,035 from yesterday. And for deaths, the state is reporting 21,826, which is an increase of 24 from yesterday. For hospitalization numbers, for hospitals that are in St. Clair County, currently we have 24 patients that are admitted due to COVID-related reasons, and 2 of them are on ventilators. Regionally, we have 43 patients that are admitted due to COVID-related reasons, and 3 of them are on ventilators. We have no new updates for our congregate living facilities that are in outbreak status. So I will turn it over to Chairman Kern for his update.
Okay, Sam, that was quick. Nice job.
Yes.
All right, let's take a look at the zip code report. 62206, we're up 5 to 1,378. 62208, up 3 to 1,706. 62220, up 7 today to 2,161. 62221, up 10 to 2,897. 62223, up 3 to 1,837. 62225, up 3 to 152. 62226, up 8 to 3,318. 62232, up 2 to 931. 62243, up 2 to 800. 62254, up 2 to 820. And 62269, up 8 to 3,385. 36 new COVID positive diagnoses today. 841 people got tested. That brings our daily county positivity here in St. Clair County up to 4.3%. But the rolling average, the 7-day rolling average, does go down today to 4.4%. Regional positivity is down to 3%. And the remaining counties in the region include Bond at 0% today. Good job, Bond. Clinton County, 0.6%. That's good, too. Madison, 3.2%. Monroe, 3%. Randolph, 0%. St. Clair County is the topper today at 7%. And Washington County is at 2.9%. So still COVID out there, Herb.
Still out there, and we continue to watch those numbers fluctuate. And today is our question and answer day. Brian, we get just a few today. Why don't you get into them?
Okay. Sam, we'll start with the health department questions that came in. The first person asked, why is it optional for students to wear masks in public schools? Shouldn't parents be aware that their kids are in school with others who are not wearing masks?
So to our knowledge, we are still under the impression that schools and bus systems are requiring children to wear their masks on the buses and at school. If anyone has a concern about a school or a bus system that is not implementing those requirements, please give the health department a call, and we are happy to inquire and see what the situation is with those schools.
Okay. The next person says some other counties are offering clinics at high schools. Do you think St. Clair County will offer those?
We do not have any of those scheduled at this time. However, our mass vaccination site at the fairgrounds is open 6 days a week from Thursday to Tuesday. We are closed on Wednesdays. And our times are from 8 a.m. to 6:30 p.m. But from 9 a.m. to 5 p.m., you can show up without an appointment, and we will schedule you on site and have you go through the vaccination line. Sometimes that's a little easier for those who might have time constraints who can't commit to an appointment time. Feel free to come down any of the 6 days that we're open.
Okay. The next person said, is there any new research on if a vaccinated person can catch COVID and spread it to unvaccinated people, kids in particular?
So there is a very small percentage that someone that has been vaccinated with Pfizer or Moderna, so that's a 2-dose shot, and they're 14 days out, that they could still contract COVID. The percentage is very small. Those are considered what are called breakthrough cases, and there is criteria from Illinois Department of Public Health on how we classify them and what is required for those patients that are considered truly a breakthrough case.
So if they do contract it, they then could spread it.
That is correct.
Okay. The last one that came in for you today says, if I lose the card with my name on it and the date I got vaccinated, who would I call to have that replaced?
So we have the COVID call center that is housed over here at the EMA building, and there are 2 numbers that you can call, 825-4447 or 509-6010. You can call either one of them and let us know that you've lost your card and your name and your birth date, and we'll be happy to get a new one out to you.
Okay, thank you very much. Chairman Kern, a couple questions that came in for you today. The first person said, with 30% of the county vaccinated, why are St. Clair County leaders not doing more to ask the governor to open up?
Well, I think the Illinois Department of Public Health is giving guidance to the governor related on a lot of metrics. Now, we continue to see hospital admissions for new COVID cases going up in the region, and hospitalizations are up. So those are 2 metrics that we are still failing on right here in our region. Throughout the state, there are areas that are having hotspot issues. They're taking care of those. I think the goal is to get that positivity rate lower than it is today, much lower than it is today. The main restrictions are really on large gatherings. A ton of people inside is what they're really trying to avoid. It seems that most of those restrictions on inside dining have been loosened up about as far as they're going to go until it's totally open. So we continue to work with the Illinois Department of Public Health, Governor's Office, our state senators, our state reps. Everybody's interested in getting things opened up again. And I think that we are seeing that light coming pretty soon. The light at the end of the tunnel will be out of the tunnel, we hope, in fairly short order. But as you saw today, our positivity rate in the region still is 3%. We're hearing places like LA that had big spikes, they're down to 1%. So I think we got to fight to get these numbers down a little bit farther. People are getting vaccinated. There is a lot of immunity in the community. You're right. We've put a lot of needles in arms, and that's a great thing. But I think that Illinois Department of Public Health is just taking a look at, we've got to drive this virus down to an extremely low level so that we can get rid of the masks and don't have to worry about transferring this virus to those, frankly, who haven't gotten vaccinated. That's the push now, and the reason for any slowness is it's slowing down the number of people who are getting the vaccines. Yesterday we had 660, I think, that were at the fairgrounds. There's a load of capacity, a load of vaccine that we could have done yesterday if people had showed up to get it. So I want to encourage people to let them know we're still there. We're still doing this 6 days a week. It's easy. It's safe. And we can get it done for you. Get that needle in your arm. We can all get back to where we want to be. We don't disagree with the premise of the question. It's just that we've got to get these rates to where we will stop the spread of this virus.
Okay. And one other question that came in, very similar of nature, says, how much longer do we have to wait for the governor to stop moving the goalposts on reopening? 52% of 16 and older and 78% of 65 and older are vaccinated. Cases and death rate is flat. The COVID-like rates, which is a vague metric, is decreasing. The same is true of hospitalizations. Other states are open and their cases are dropping. These restrictions are unnecessary as people are out living their lives normally. If people are scared and want to stay home locked up voluntarily, that's fine, but let everyone else move on.
So, and I'm not going to take all of the points of that argument, and there are some things that may be correct, some things that probably aren't. What I am saying is that we've got 25 people that were COVID positive today that we know of that were under the age of 40. Let's continue to work on the younger population, getting them there, getting them vaccinated. That's the next segment of population, because after all, we have 2 people on ventilators right here in St. Clair County. I think 3 in the region, 24 people that are in the hospital right now with COVID. We've got to get it under control. It's getting there. It is. It has flattened. I agree with all that. It's just we're not quite there yet, and we don't want to be the ones that jump up and have another spike.
Well, one of the things that whoever the author of that question is needs to take into consideration, it has flattened in other parts of the country just to turn around and see spikes come back up. And I think that's why the Department of Public Health is saying, let's be cautious, let's give it a little bit longer, and then we can all put this behind us and forget about it. So we appreciate those questions like that. But again, we are on the phone daily with IDPH. Friday we had a IEMA call. We do that every week. So the county is doing everything they can. There's nobody who wants to get to open up quicker than we do, other than Team St. Clair members. So we're here arguing that point also, but we're also going to err on the side of caution because we have lost 475 of our county residents to this. We don't want to lose no more. So if it means waiting a little bit longer, please have patience. The health department is doing everything they can daily. The National Guard, everybody at the mass site, what everybody can do is spread the word. Continue. You just heard the chairman say, you heard Sam say yesterday, 660 some people got vaccinated, which is great. That's 660 more people closer to the end of this mission. But there's more capacity out there. We know that. We know there are people who are hesitant to want to get the shot. That's their prerogative, but the statistics will show you that these needles in the arms will help us get back to what the new norm is going to be.
And inside dining is working.
Yes.
I mean, our business owners are really, they've been through these 408 days and have gotten through. There's a lot of plexiglass. There are a lot of safety issues. The servers are wearing masks. It's working. So you can get out to your favorite places and do things just like you wanted to do. It's just there are a few restrictions left. And they'll be lifted, we hope, very soon. But they're in place for a reason. They're so we can actually go out and enjoy dining and be back in the places that we like. They're open. Make sure you go and patronize them. We encourage people to follow a safe pattern, but get out and support local business.
And that's it for today. Cindy will be back to translate this into our Spanish communities, and then we'll be back tomorrow for day 409. Everybody have a good rest of the evening. Thank you.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.